Is your heart trying to send you a message, a signal that there is a flutter in your chest, a missed beat, or a racing pulse without any clear reason? It might not be stress, and it might not be too much coffee. It could be atrial fibrillation, the most common type of racing the upper chambers of the heart. It's also called AFib, a condition millions of people live with right now without even knowing it. And here's the real damage. AFib can seriously ramp up your risk of stroke by at least 5 times, and even higher if you have any other risk factors. If you are over 65, if you have history of diabetes, if you have history of high blood pressure, or even if you had a prior stroke or even a minor stroke, we call the transient ischemic attack or TIAs. Today, I'm counting down the top 7 AFib warning signs you should never ignore. And stick around, because the most dangerous and surprising is right at number 1, and it's the one that catches people off guard. Hello friends, I'm Dr. T, board certified in cardiology, electrophysiology, and lifestyle medicine. And I am an electrician for the heart. But before we get to the countdown, let's quickly explain what atrial fibrillation, this most common racing in the upper chamber of the heart, is. Atrial fibrillation is an irregular, often very rapid heartbeat that causes the upper chambers of the heart, the atria, to beat out of sync with the lower chambers, the pumping chambers, the ventricle. And this affects how efficiently your heart pumps blood and increases also the risk of dangerous clots, stroke, and other embolic events, and heart failure as well. The tricky part is that it doesn't always feel like you'd expect, which is why this countdown is so important. Number 7, chest pain. Not everyone with atrial fibrillation experiences chest pain, but when it happens, it's a sign that your heart is under strain and the stress. You might feel a dull ache, a tightness, or pressure in your chest, and it could last for seconds, minutes, or even hours, and can come and go. Any kind of chest discomfort, especially alongside other symptoms on this list, needs attention right away. And if you have coronary artery disease, if you're known to have blockage in the arteries, in the pipes that supply blood to your heart, if you had a prior heart attack, you can get angina and even rarely a heart attack. Number 6, trouble exercising. If you find you can't keep up with activities like walking the dog, gardening, climbing stairs, going to the mailbox, back and forth, as you did before, it could be a sign of atrial fibrillation, because the irregular rhythm makes it harder for your heart to keep up with the demands of exercise, reducing your stamina and making you feel worn out faster than usual. I would say when you are in atrial fibrillation, it's like having your car working on 3 cylinders instead of 4. Number 5, dizziness or lightheadedness. AFib can interfere with blood flow to your brain, causing dizziness or lightheadedness. You might feel unsteady, woozy, or like even you're about to faint. And in some cases, you could actually faint. If you experience these sensations, especially combining with a rapid heartbeat or chest discomfort, that's a warning sign you shouldn't ignore and seek medical attention right away. Number 4, unexplained fatigue and weakness. Everybody feels tired occasionally, but with AFib, you might experience an unusual persistent fatigue. Even after a full night's sleep, you could wake up feeling drained, or you might notice you tire out doing simple everyday tasks. This happens because your heart's irregular rhythm makes it less efficient at circulating blood, leaving your body under power and fatigued. Number 3, shortness of breath. Ever feel winded doing something simple like walking across the room or bringing in the groceries? In AFib, the heart's irregular rhythm causes blood to back up into your pulmonary veins and into your lungs. And this makes it harder for you to breathe, especially during activity, but sometimes even at rest. If you are suddenly short of breath without a clear cause, don't dismiss it. And if you want to learn more about causes of shortness of breath, watch this video, atrial fibrillation and congestive heart failure. I'll put a link above and on the description below. Number 2, fluttering and palpitations. This is probably the most recognized and most common symptom of atrial fibrillation. You might feel a fluttering sensation in your chest, a rapid, irregular pulse or heartbeat, but these noticeable, sometimes uncomfortable heartbeats that feel like your heart is pounding, skipping, or racing. These episodes can happen randomly, lasting minutes or hours or even days, and they can come and go. And number 1, here's the scariest part and why AFib is so dangerous. Some people don't feel a thing. They don't have any fluttering, no shortness of breath, no dizziness, nothing. And that's a huge problem because untreated atrial fibrillations increase your risk of stroke by up to 5 times, and in addition could lead to weakening of the heart muscle, what we call cardiomyopathy, leading to congestive heart failure. And in fact, for many people, the first sign of atrial fibrillation is a stroke. And I've had patients who were absolutely shocked because they showed up in the hospital with a stroke, not knowing any idea that they had been in atrial fibrillation for quite some time. That's why checking your pulse regularly, heart screenings, and especially if you are over 50 and have any other risk factors, high blood pressure, diabetes, it's very important to check your pulse, make sure there is no issues there. Let's quickly recap those 7 warning signs of AFib you should never ignore. Chest pain or discomfort, trouble exercising, dizziness or lightheadedness, unexplained fatigue and weakness, shortness of breath, fluttering, racing, palpitations, and no symptoms at all, the silent danger, the silent killer. And if you or someone you love has experienced any of these signs, don't ignore them. Talk to your healthcare provider. And if its symptoms come on suddenly or feel severe, seek medical care right away. Did any of this sound familiar? Drop a comment below. I'd love to hear your experience, and your story might help someone else watching this video. And if you want to learn more about strokes in atrial fibrillation, watch this video, Stroke Prevention in Atrial Fibrillation. Put a link above and on the description below. And remember, your health, you must precious the set. Take control. See you next video.